Hello students, let us talk about anti-diabetic drugs, also known as hypoglycemic agents. Before talking about the classification of anti-diabetic drugs, let us very briefly understand the pathophysiology of diabetes mellitus. You can see from this flow sheet, hyperglycemia means there is enhancement in blood glucose level. The possible reasons can be something is wrong with beta cells of pancreas, beta cells which secrete insulin. It is the job of this insulin to make glucose enter into the cells. So when there is some defect with beta cells, maybe their degeneration or they are insufficient in number, means something is wrong with beta cells. They do not secrete sufficient insulin that raises blood glucose level in the blood, that is hyperglycemia. Other possibility is that glucagon secretion is in excess. Pancreas also secretes glucagon from its alpha cells. The physiology of glucagon and insulin are opposite to each other. If glucagon secretion is in excess, naturally there is a reduction in insulin secretion that is unfavorable for diabetes. And secondly, the absorption of carbohydrates, their delivery etc. through certain transporters, that is maximum. They undergo glycolysis, means breakdown of glucose, and that also leads to hyperglycemia. And thirdly, there is excessive glucose production via liver, via glycogenolysis, that is hepatic glucose production is excess. Third possibility is there is excessive peripheral glucose utilization. And when there is hyperglycemia, that further leads to glycosuria, means appearance of glucose or sugar in the urine. So this is the main pathophysiology of diabetes mellitus. The overall result is there is increased blood sugar level in the blood, that is hyperglycemia, which leads to glycosuria, means appearance of glucose in the urine, and this overall condition is diabetes mellitus. Now let us talk about this classification of antidiabetic drugs. Now, the classification of antidiabetic drugs can be there on the basis of routes of drug administration. So, these drugs are given either orally or parenterally. So, antidiabetic drugs given by oral route include insulin releasers, that include sulfonylureas, meglitinides, phenylalanine analogs, and insulin sensitizers, that includes bigonides, thiazolidinediones, dipeptidyl peptidase 4 inhibitors, and alpha glucosidase inhibitors, dopamine D2 agonists. And secondly, we can have antidiabetics, that is drugs administered by parenteral route. Here we have insulin and its preparations, amylin analogs, GLP analogs. And now antidiabetics can also be classified on the basis of their traditional, means older drugs and newer drugs. So among the older drugs or traditional drugs, or you can say first generation drugs, secondly newer drugs or second generation drugs. So older drugs include insulin releasers, that is sulfonylureas, which we just now discussed, insulin sensitizers, thiazolidinediones, bigonides, dopamine D2 agonists, insulin and its preparations. Now among the newer drugs, we have dipeptidyl peptidase 4 inhibitors, GLP-1 analogs, SGL2 inhibitors, and alpha glucosidase inhibitors. These would be newer drugs or second generation drugs. We have another way of classifying antidiabetics, that is on the basis of a chemical structure. So chemical classification of oral antidiabetic drugs, we are talking sulfonylureas, bigonides, thiazolidinediones, carbohydrate derivatives, or you can say sulfonylureas and non-sulfonylureas. We can also group them like this also, that is Antidiabetics given orally, they have a sulfonyl structure, sulfonyl ureas and non-sulfonyl ureas. Thank you.